Thank you so much for being with us, Dr. Michels.
Glad to.
Okay, I know everyone out there knows you have such a wonderful reputation in our community. Give us a little bit of your background.
Well, you know, the thing that I'm most proud of in my life is my family. You know, we have 8 children. We're now on our 17th grandchild.
Amazing.
And so in the end, that's what is most important. And I've had a successful career in dentistry as well, but that's what's the most important thing to me.
Treating people like family. It's part of your motto. People feel good when they walk in the door. We'll talk about other reasons for that in a minute, but you do treat people like family here.
Yes, we do. That's the goal. That's how I've trained everybody to do that, and it stems from my wife early on in our marriage had different medical problems, and we had to go to a lot of different physicians. She's all good now. But boy, from that experience, I said, I am never, ever going to run in any office that I own like those offices treated my wife. Never, ever.
And so we say anxiety-free dentistry. It sounds like breaking news to me, because how can you do anxiety-free dentistry? But I've heard it from your patients. You truly do take it out, the stress out of coming to the dentist. Tell us how you do that.
Look into my eyes. No, it's not anything so strange as that. It is stressful to come. I don't like to get treatment done on me. I don't want any shots, whatever. I go into a sweat. But it can be made more comfortable, and it stems from people treating you kindly and like family, so you knowing what's happening. If you're real nervous, you can be sedated in a way that you won't feel or remember anything, if that's what's required. And we talk it over with each patient, and you just make them comfortable. People can do it, but everybody's nervous. Put them at ease and they're less nervous.
We hear so much about cosmetic dentistry these days, and I know you do offer services like that here, but do we really need to get back to the core of general dentistry and really making sure we come in for our checkups and those type of things, so we maybe don't need those procedures later?
Number one thing, you have to be healthy, period. Okay, so our original and most important goal is to keep you healthy, that your oral health is healthy, that we know that your oral health can affect the rest of your body. All the bacteria is related to heart disease, diabetes, rheumatoid arthritis. So it's important that you stay healthy. So that's our initial goal. And it's easy to do cosmetic procedures and get people to look good.
Give people an idea of what that's like.
The big thing is that essentially what happens is you're taking a heavy dose tranquilizer, and you come into the office early. Sometimes we'll give you something to take the night before if you're nervous, so you get a good night's sleep. Come into the office, you get this pill before. It very much relaxes you. You do not care what's going on. It's an amnesiac. You really don't remember very much. Then they use nitrous oxide on top of that, and we try to perform all of the procedures at the same time. Because most people, if you put them at ease, they can suck it up and manage to come in, but don't ask them to come in a whole bunch of times. It's too much.
I think that's really helpful, so you can kind of, get everything done at once. You don't have to keep making your appointments, coming back, getting worried and coming back. That's a big step.
And taking off of work and
right.
all of that. Yeah.
We talk about experience. There's so much experience under this roof here that people can really, and under,
It's gray hair. It takes a long time to get that experience.
I mean, combine more than 100 years of experience between
Yes.
all of you.
Yeah.
And that really does set you apart from other
I'm not
practices.
that old, but between my
No, you're
partners
not.
and I, we managed to do that. Right.
And you do offer the latest cosmetic dentistry.
Oh, yeah.
You have Invisalign here now.
Yeah, that's a big deal now. I mean, for adults, people are not wearing those big brackets on their teeth, and Invisalign is really cool, the invisible braces, and it's easy to correct people. You don't have to go around with a bunch of crooked teeth. And it's not so much for a file, for your cosmetic, to look nice for your smile. Your teeth need to be straight. If they're not straight, you wind up with more periodontal gum problems and bite problems over time. So you're better off to have them straight as not.
Last thing, are you accepting new patients right now?
Sure, anytime.
Wonderful.
Glad the more the better. I love taking care of people.
Yeah.
That's the big thing. I love to meet them, to talk to them, and
Well, thank you so much for being with us. It was very educational and informative, and we really appreciate your time.